May all beings be free from suffering, especially those who are trapped in hell. Welcome, everybody. Today, today we're going to talk about a pretty gnarly topic, but it's a very important one. And it's one that I think if we focus as a community and actually make direct, persistent action towards these goals, we will be really improving the world in an unprecedented way. Maybe more significant than, for example, the introduction of anesthesia to medicine. And I don't say this lightly. I actually think it is up there as a possible gift to the world. Now, I am going to be talking about extreme suffering. And I don't only talk about extreme suffering. You see, I talk about a lot of interesting things. I talk about, the geometry of, DMT levels. I talk about the joy of jhanas. I talk about like the phenomenology of MDMA and, unconditional love and lots of things like that. And I think that it is important. It is important to actually talk about, the full spectrum to understand the positives, the extreme positives, understand the things that gets us going in the morning, the reasons to be alive. But also, we cannot neglect the other side, the things that actually make us not want to exist. And there are big things that we can do in order to push the global hedonic range, as it were, from, touching the extremes of suffering to, at the very least, being baseline to, hey, delivering access to the world to safe, sustainable, wonderful technologies that produce MDMA-like states, of love and empathy and, bodily wellness in a sustainable and healthy way. But I think the complete package is not complete without really emphasizing that intense suffering is a very big deal, and it is morally urgent that we actually tackle it. So I'm going to give you a little bit of an introduction. I'm going to give you some basics. I'm going to give you what I have seen works and doesn't work. I'm going to give you as well information about what we're planning to do in the future. And also, a couple kind of like scattered requests, especially anybody who has used this technique to abort cluster headaches. Please, contact us. Like, we would love to get your testimonial. And there is a link in the description where we're gathering video testimonials, which is, I think, the most powerful, especially, from a PR perspective, spreading the word. But also, written testimonials. Also very happy to just have an interview with you and, turn that into a text, whatever works. And there's also some, a little bit more kind of experimental out there experiments, that I think actually are extremely high value and probably fairly safe. I don't want, to come across as like, saying like, hey, please do this, because who knows, who knows what's happened. But if you have a high, risk tolerance and you suffer from this condition and you're willing to experiment a little bit, you may provide enormously useful information for the world. So I'll just leave it at that. So let's get started. So we're going to talk about using DMT to abort cluster headaches. This surprises people, right? Like I mentioned this and people think I'm joking, but it's like, oh, the DMT guy, the guy who talks about the hyperbolic geometry of DMT experiences is now saying that DMT is a panacea. It cures, it gets rid of migraines, it gets rid of cluster headaches, it gets rid of hemicrania continua. Like, it really sounds, crackpotty, like the kind of hippie who will, say that, they're, I don't know, royal honey mixed with pollen, cures pancreatic cancer or something. Is like, well, yes, I mean, you think about raw honey all the time. So yeah, you will probably, he who has a hammer, will see everything as a nail. But in this case, I swear that's not what's happening. This took me by surprise, and I would not be promoting this if I didn't actually think this was a really serious possible intervention for reducing drastic amounts of suffering in the world. So, the first time I found about this was around 2019 when I was conducting some research on the logarithmic scales of pleasure and pain. This is written up in EA forum posts, as well as down the line, we also published in peer-reviewed articles, peer-reviewed papers with Chris Percy and other collaborators. And, we rebranded it as the heavy tales of valence hypothesis, which roughly says that, the intense experiences, the intense range of both pleasure and pain is not just, one or twice as intense as kind of the mid ranges, but potentially, one or two orders of magnitude, right? So we provided compelling reasons to believe that, for example, 10 out of 10 pain, such as what you may experience with kidney stones, or, severe benzo withdrawal. People don't believe me, but yeah, it really does seem to be the case. Or cluster headaches. Cluster headaches may actually go higher than 10 out of 10, although that's a topic I'm not gonna talk very much about today. Well, in all of those cases, if you talk to people who have undergone those extreme experiences, generally speaking, they will say that the actual intensity of the experience, the intensity of the suffering and the discomfort was, let's say, like 10, 100, maybe even 1,000 times, brighter, like worse, more repugnant than, something they might describe as like 5 out of 10 pain. I'm not going to repeat the reasons. I mean, there's the articles online. There's also like presentations I've given specifically about this topic. But this is something I feel quite confident on. And, starting from that basis, I recognized, oh my gosh, just as, for example, in effective altruism, people realize, well, if you apply kind of this 80-20 logic for where to donate your money to improve the life of people in the world, chances are, if you understand, that suffering follows this like extreme distribution, right? Like we're like the top 1% of suffering is just orders of magnitude worse than, the top 2%, and so on. Like, it really ought to reprioritize like how you see the world when it comes to making it better. Cutting off the extremes, negative extremes, becomes a tacit priority. And I would argue, you don't need to be a classic utilitarian to actually believe these. I would argue that, from deontological perspectives, from, virtue ethics, and of course, negative utilitarianism, classic utilitarianism, prioritarianism, pretty much any, popular, sensible, ethical framework that I can think of would essentially agree that if there is a ridiculously cheap intervention that is very effective against some of the worst types of suffering, that bubbles up as a priority. Now, a utilitarian may want to know more. They may actually want to know, like, okay, but how many patients, how much do they actually suffer? How much are you actually going to relieve their suffering, and how much is it going to cost? And, if you are of that ilk, we have a pretty thorough analysis, largely done by a collaborator, Alfredo Parra, in EA forums, which is titled Quantifying the Global Burden of Cluster Headaches and Migraines. And essentially we use empirical data as well as explicit assumptions, which you can tweak. You can put your own numbers on, the various assumptions. And with that, it is a fairly robust finding that cluster headaches bubble up as one of the major causes of suffering in the world. Meaning that even though they're not that common, if you actually prevent them, you're going to be getting rid of a significant percent of world suffering. Maybe double digit? I mean, imagine that. Imagine something simple like distributing DMT cartridges to people who suffer from cluster headaches. I mean, you can manufacture them for like $3 or $5, and if you're mass producing them, cutting down 15% of the world's suffering. Imagine that, right? Like, so that is the sort of thing that, keeps me very motivated and and hopeful on this topic, because it really does seem very doable. But there's of course a lot of caveats and important considerations, and so I'm gonna give you kind of like an info dump. Pretty much everything that I'm gonna be telling you, my level of confidence on it is between like moderate and very high. Nothing that I will tell you is something that I feel like I'm not sure. I'm kind of like iffy about this. Now, it's very likely that I will make mistakes, right? Like this is an ongoing area of research, and it's quite likely that we will find, counterexamples to some of the things that I will tell you, or we may find like better protocols. But I do think that sharing, as soon as possible, what I do know with the world in a consumable format is actually really beneficial. So without further ado, I'm just gonna go through the content. I'm trying to speak more slowly. David Pierce recommended I did that. Otherwise, I just power through. But yeah, speaking more slowly, carrying a calm vibe. Let's not get too agitated just because we're talking a very gnarly topic. Actually, as an aside, that might be one of the things that people value about some of my videos and content is like, I do talk about very gnarly topics, but hopefully with a good vibe and compassion, as opposed to helplessness or kind of, suffering as I say it. He's like, no, it does makes me extremely sad that these things exist. But I think that the best way forward is actually, carrying a good vibe and like just focusing on the effort. That is what's gonna work. Okay, so first of all, some of the basics. About 1 in 1,000 people suffer from cluster headaches. Typically, they present themselves as like episodes that last between 1 hour to up to 3 hours. For some people, it's like as short as like 40 minutes, but like usually that is kind of the range. They tend to happen at the same time every day, and they tend to divide into two types, which is episodic and chronic. People who have like episodic cluster headaches, they only happen for a fraction of the year, maybe 2 months or 3 months. Typically is seasonally triggered. People may actually have knowledge that, okay, my cluster headaches get activated on like around like February 20th or so, and it's like very reliable. And at the same time of the day, researchers suggest that this indicates, cluster headaches are related to the circadian rhythm at the very least, or like hormonal releases through circadian rhythm adjustments. Another interesting, suspicious reason to believe this is that cluster headaches actually adjust to save daylight savings time. Like somebody might be having cluster headaches at 11 p.m. Every day, and then daylight savings time starts, and then over the next several days, like it goes from like 11 p.m., 11:20, 11:40, and then it adjusts to like midnight, which is like the same kind of like point in the day relative to when they usually go to sleep. So yeah, it really seems to be implicated with the circadian rhythm. The pain of cluster headaches is extraordinary. I have not experienced it, thankfully. I I really hope I never experience it. It seems to be one of those pains that is inherently traumatizing. I am very skeptical, for example, that even advanced Zen monks would be able to not transform that pain into suffering. I'm very skeptical, because it's worse than, for example, being burned alive. It's worse than amputation without anesthesia. It's worse than a lot of things that you would imagine, like, okay, like, does pain go any further than that? And, the very horrible thing is that not only it goes further than that, but it actually may do so an order of magnitude or more. You often hear people saying like, well, from a scale from 0 to 10, a cluster headache is a 15, right? And I don't think they're kidding, and they are using something like a logarithmic scale implicitly here. the pain, here's something that I get often. People often, they like to prioritize, psychedelics for depression, anxiety, and so on, which of course, that's good. It's good that we are doing that research and we're advancing those causes. However, it is very common for people, this is naive, this is not like they're bad people. This is not like, they're like, they lack compassion. This is just naivete, you just don't know. You just don't know, right? That really intense pain essentially tends to just transmute into extreme suffering. Also extreme psychological pain. So cluster headache patients is not only, that they experience 10 out of 10 pain physically, like they might describe it as like, oh, it feels like there's an red hot ice pickle, actually like entering your eye and kind of like being wiggled around, and just like as a torture device of sort. It's like, why am I still alive? how is this pain not killing me? That is the typical response. But in addition to that, as if that wasn't enough, it also comes with a profound sense of doom, a sense of abandonment, a sense of God betrayed you, like a sense of reality hates you. Again, I haven't experienced these. I've experienced very unpleasant, let's say, like psychedelic states, like bad trip-like states of consciousness back in the day. Not in a long while, but I am familiar with what like a pretty unpleasant, psychedelic state might be. They tell me this is worse, that the doom you feel on a cluster headache is itself next level, right? Like if you could isolate the doom independent of the pain, that also would be an outlier in and of itself. Okay, so I really want to emphasize that this concern that like, well, I can deal with pain, the thing I can't deal with is depression, is misguided. Is like you just don't know the reality of things. And yeah, I don't want it to be condescending, but it really does seem to be the case. And this is very significant from the point of view of effective altruism, right? Because very often, this is a little bit of a sociological observation, right? But like, think of like high systematizers tend to actually, on average, have like high pain thresholds. So they, on average, and this may have to do with prenatal testosterone and empathizing, systematizing spectrum, and so I think it's actually very common for like high systematizer to like actually not suffer very much because of physical pain, especially not in the youth, right? Like especially if they don't have like a chronic condition or they're suffering from migraines or something like that. So it is not that uncommon, I think, for the people who kind of call the shots about like what we should prioritize to themselves just be ignorant about this matter. Or like they just don't know that actually pain of this sort exists and that it is also suffering. There isn't a clean distinction. In fact, I would argue that pain and suffering are kind of two sides of the same coin. They're really, dissonance in the field at the end of the day. Except that pain is like really high frequency dissonance, essentially really highly localized. Whereas suffering is kind of like low frequency holographic dissonance. And okay, yeah, this is a very speculative thing, but I suspect that mathematically they're tapping into the same thing. It's not like they're fundamentally different things, and they're both bad, right? So yeah, let's stop this idea that like, okay, like suffering is independent from pain, or like that pain is not as bad as like depression or anxiety or something like that, which is just not the case. Also talking to Bob Wald and people who have these conditions, they will effectively assert that for most of the cluster headache patients, they have comorbid depression and anxiety, but it's not independent of the cluster headache. In fact, is usually caused by the cluster headache. A single cluster headache will typically give you lifelong PTSD, is what I've heard. I must emphasize, because these are like long tails, a person's cluster headache may be like itself like 10 times less bad than another person's cluster headache, which makes this a little bit murky. Like I'm a little bit cautious, generalizing too much, because for some people, they may say like, yeah, well, their cluster headache was not as bad as their kidney stone. And well, lo and behold, kidney stones also follow a long tail distribution. These long tail distributions will keep coming up whenever we do a hedonic analysis, is my claim. And there's a very simple reason why, and it has to do with the kind of like multiplicative properties of these factors and how they come together to really create like avalanches of activity. The most straightforward analogy is, if you look at distribution of avalanches in the world, right? Like some countries have a lot of avalanches and some countries have very few, and there's a few countries that have, one or two. And the reason is so skewed, right, is because the factors multiply each other, right? Like you need the right temperature, the right humidity, the right landscape. And, the frequency of those factors itself also tends to follow kind of these long tail distributions. As a consequence, when you actually multiply the amplitude of all of these factors to get kind of like, hey, what is the amplitude of the result? Such as like how big the avalanches are, how much snow do they carry? That distribution itself will be extremely skewed. And the factors that feed into a cluster headache, I think, are essentially something like that. So like for some people, they may have a bunch of these factors. Maybe one of those factors is very low in its kind of contribution, and therefore like it all gets multiplied downwards, and they may get the impression that, okay, it's not as bad. We really need a science here. We're developing it at QRI, but yeah, we really need to change to a paradigm where we acknowledge the logarithmic scales of pleasure and pain, make that a scientifically valid understanding. Okay, so enough about like the actual phenomenon. I do know actually a lot more about like the specific feelings of it. I don't think it's very helpful to mention it here, but what I want to emphasize is that it really is that bad. So yeah, people essentially very often kill themselves to avoid any further experience of this sort. Okay, so what are some kind of like predictors of cluster headaches? This is just like, going through the literature. Genetics is a very big factor. If one of your family members, close family members has cluster headaches, I believe you have like a multiplier of like, 18 times higher probability that you will develop cluster headaches rather than people in the general population. Smoking, how much you smoke, how often. I'm talking about cigarettes here. I'm not aware of like marijuana smoke itself being a problem, but I would be actually surprised if there wasn't some correlation there. But it really does seem that tobacco smoke in particular is pretty bad. This is both in terms of lifetime consumption of tobacco and then your probability of developing cluster headaches. Actually, if I was campaigning against tobacco use, which I think is a good thing to do, all things considered, is actually, a very powerful intervention potentially, I might actually emphasize like, hey, this is like doubling, tripling, quadrupling your chances of getting cluster headaches. People don't think about that, right? When they start smoking. It doesn't occur to me, like doesn't occur to you to, consult the internet and see if the habit you're developing has like, a small probability of extraordinarily bad outcomes. Yeah, people don't tend to do that. But yeah, that is a very, very strong factor. Alcohol is interesting because it's typically a trigger, but it doesn't seem to be causative in the sense like, if you drink alcohol, that doesn't seem to raise your chances that you will develop cluster headaches. But if you have cluster headaches, it is highly advisable that you do not drink. I cannot count how many times I've seen, let's say like Reddit posts in cluster heads, like people who post about these saying like, oh, I really shouldn't have had that one beer. Like it really was not worth it. Like they have one beer in a bar thinking, yeah, it's been a while, I don't get clusters. And then, going back home, they just have to stop in the middle of the highway and wait it out while screaming in agony for 3 hours. So yeah, alcohol, it's a very well-known trigger. So very, very worth avoiding. Head trauma, it's another, predictor of cluster headaches. apnea, sleep apnea, which is, yeah, kind of surprising and interesting. So like, if you're at risk or you suffer from clusters, definitely I would recommend checking out treating your obstructive apnea. And then age, yeah, essentially, um, onset of cluster headaches in later ages, or like when you're older, um, predicts that they're much more likely to be chronic, meaning that is something that you will experience every day. Okay, so let's move on to like why I'm so confident. Actually, we as a community at this point, the core team of collaborators at QRI and people who are, yeah, trying to move this cause forward. Yes, why are we so convinced? Because there's no peer-reviewed, published article in a credible journal that says DMT, aborts and prevents cluster headaches, right? So why am I so confident? Why am I like willing to stake, my reputation and put a flag in here and say, God damn it, this is very important? Because the evidence is actually really strong. It's just unconventional. And there's a lot of situations where this happens. Just one example, like when COVID was starting, you would see in the media people talk about how, well, there's no evidence that this is going to become a pandemic. There's no peer-reviewed study that indicates that COVID is going to become a pandemic. But the rationalist, is like, okay, this is growing exponentially, and they were like, seeing where the trend goes, and we're saying, yep, this is gonna become a pandemic. It's unstoppable now. They were, raising those alarms, a month before there was some kind of like mainstream consensus that, oh, dang, yes, this is inevitably a pandemic. So when you have a high concentration, of smart, dedicated people who, are checking each other's work and, have a tradition of having like good epistemology and, actually they really care about the outcomes, oftentimes you've got to trust, that as opposed to the official line. Because the official line, there's like oftentimes like structural reasons why the truth just doesn't come out until it's too late. The other, very good example, I think it's anesthesia, the development of anesthesia for surgery. This was known, actually discovered by like Davy and then Faraday, which was that nitrous oxide and ether, chloroform, taking at sufficient concentrations would actually make you unconscious, and also just completely numb to, intense physical sensations. And, this is something that they knew with high confidence, right? Because they personally had tried it. They had tried it with friends. Things such as like, well, okay, I'm having this extreme pain in my teeth. I need a teeth procedure, and then they would use like chloroform, and it's like, wow, okay, like I don't feel it at all. But somehow like that information just didn't really convince doctors. It really didn't convince the mainstream, and it really wasn't until 45 years later, like almost 50 years later, where there were like public demonstrations of using, anesthesia for surgery, where it actually worked, right? And I think that this could have been accelerated, right? Like I don't want to be like so cynical to say like, oh, it's just human nature to ignore these like huge blessings and just forget about them and have like hundreds of millions of people suffering in the meantime. No, I mean, I think we can get better at it. But we're not very good at it yet, it seems like. But okay, like, very concretely though, why am I like super confident? The inside view is as follows. So Bob Wald, founder of cluster headaches, he was looking for medicines that could help his own cluster headaches for years, like I believe like 20, 30 years. And he tried up to like 70 different compounds in all kinds of dosages and combinations and protocols, and while the cluster headache is happening, before, like after it, and pretty much nothing worked until he explored psychedelics. And then he had near miraculous, relief. Now, the psychedelics are kind of tricky, and the standard protocol that was like started to be developed by this community, which is essentially like a busting protocol, as they see, as they describe it. Involves taking, psilocybin or LSD, like let's say once every 3 weeks, and doesn't talk about DMT originally. Okay, but down the line, though, when Bob Wald actually encountered DMT, he said, "Oh my gosh, actually this works way better. This actually aborts it right away. I don't have to wait 30 minutes for the LSD to kick in to start to feel some kind of relief. I can just like take a very small dose of DMT, and within 10 seconds, the pain goes from 10 out of 10 to 1 out of 10. Okay, so we're talking about like stratospheric effect sizes being reported by somebody who thoroughly knows all of the alternatives, is at the center of this community of people who are highly motivated to find cures, and who reports that it works just better than everything else that they have tried. And it's not just him. You will see in the QRI YouTube channel, I have an interview with people from Clusters Busters, Joe McKay, for example, who is a 9/11 survivor. Well, anyway, he dealt with a lot of PTSD from that, and developed cluster headaches, and psychedelics helped him enormously. And he was like, well, yes, I was so thankful for mushrooms. They gave me a hope. They really reduced my suffering. But DMT is the breakthrough, man. And I don't mean breakthrough in the sense that it can take you to a breakthrough level experience, although it can also do that. But breakthrough from a medical perspective, from an ethical, moral, urgency, triage perspective, it is a breakthrough. It is a breakthrough that DMT just seems to be kind of in a league of its own when it comes to how good it is at solving this. In fact, Bob Wald, as he describes in that interview, he actually suspects that cluster headaches are literally caused by not having enough endogenous DMT. I don't know about that, but it is telling, right? Like it is telling that such a person would actually say like, yeah, like maybe this is the cause. It's not only like a really good treatment, it's actually the reason why we're getting cluster headaches. That maybe you're having some circadian rhythm dependent, hormonal imbalance dependent lack of endogenous DMT. What is the DMT doing there to begin with? Who knows? But it is there. We do have DMT in us. But it's not just that. Like in 2019, before talking to them directly, just randomly like interviewing people who have gone through cluster headaches, I was aware of like, well, okay, like psilocybin seems to help, but just like randomly encountered a guy from South Africa that said like, yeah, after I found DMT, that's all I need, and I don't understand why this is not more well known. And I thought, hold on a second. And since then, there's been significant developments. I mean, on a kind of like more proximal, semi-personal note, right? Like I've been spreading this information around, and I cannot tell you just like the joy that I get when I get a message, let's say from like the dad of a friend who suffers from cluster headaches, saying, thank you for sharing this. Now my cluster headaches are pretty much taken care of. And it's what? Like, like there is enormous value in spreading this information. And essentially, when people have encountered people who are in a condition to try this and are, in the depth of a cluster headache, and it works. I have a friend who actually witnessed this firsthand. He was hanging out with a friend. He didn't know he had cluster headaches. I mean, like his friends had cluster headache before, but like, my friend didn't know that his friend had cluster headaches. And then all of a sudden, hanging out, starts having this enormous pain and just like, gets to the ground, in fetal position, and he's like screaming, and it's like, making all these horrible noises. And my friend remembered, I remember that DMT actually helps. And it just so happened, that his roommate had a DMT vape pen I guess, because yeah, they're kind of in the psychedelic sphere, roughly, or adjacently at the very least. And yeah, so he found the DMT vape pen and gave it to him. Um, and he just took a tiny bit. And within 30 seconds, it went from being in the floor, weeping and screaming, to being able to have just a normal conversation. So, god damn, like, it's one thing would be to kind of hear a few scattered anecdotes. Another thing is to say, like, hey, when people are suffering from cluster headaches, and if you suggest this and they try it, it typically works, right? Like that is like so much more encouraging and powerful. But there's many other reasons to believe this. In fact, currently there is a legitimate Yale study being conducted specifically about this, about DMT for cluster headaches, right? So yeah, no, I have no doubt in the near future, near to medium term future, there's going to be scientific consensus that this works, right? And it's just very fucking tragic that we didn't act on it first. Okay. Okay, so moving on. Very important information is medication interactions. This is actually very hands-on, very, very important. So don't combine psychedelics with lithium, for example. That is one of the most dangerous interactions that you can have. Yeah, if you're taking like high-dose lithium for, like, for example, bipolar, and you accidentally take like one hit of LSD, yeah, you are likely gonna, have like horrible seizures and you're gonna be completely out of it, and convulsions. You might need to be hospitalized. So yeah, lithium and psychedelics is no joke. I think like very, very small amounts of lithium and psychedelics like don't have that much of a problem. I've actually like heard anecdotes of people who've combined them and it hasn't been, a disaster. But I would not mess with that. I would just not mess with combining lithium and psychedelics. So, very important caveat. And, some of the substances that are prescribed, for cluster headaches do interact with psychedelics. Like DMT in particular, it is like so, physiologically safe, and also like so short acting. Like if you're just vaporizing it, that, interactions are unlikely to be fatal. But you really should avoid them, though, like to the extent that it is possible. Very relevant. Okay, so like ergotamides, triptans, of course, like MAOIs, as well as we know in ayahuasca, it's combined to extend the effects. Yeah, and things like SSRIs. But yeah, the really, really, really important ones to avoid are those that might cause like serotonin syndrome if you combine with them, or like extreme vasoconstriction. So, before you mess with psychedelics, if you're taking any medication, even, any random supplement, magnesium, whatever it may be, always, 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 check that you're not going to have like a horrible interaction. Chances are it's going to be fine, but yeah, there's some things that you really have to avoid. So as a first pass, absolutely consult with a doctor or ChatGPT. I mean, or Claude, or whoever plays ball, whichever of these like large language models will play ball, they actually will have like a lot of really good information. But yeah, double check. But if that is taken care of, and like, as an important piece of advice is like, in places where they do use, psychedelics to treat cluster headaches or migraines, they will ask you to essentially wean yourself off of other medications, so that ideally you can take, let's say, like the DMT in a body that doesn't have anything that might interact with it. It might not be necessary actually for a lot of medications, but that is like the protocol they often recommend. A few things are probably actually totally fine. Like, for example, beta blockers, like I wouldn't worry about those. Like, yeah, you can even find like Alexander Shulgin having taking beta blockers and combining them with LSD. I think like that's one of the trip reports, or in Pico. Might have not been LSD, but yeah, another one, another lysergamide. Okay, next point is a lot of kind of like ways to treat these conditions. They're quite sensitive to the technique. So I'll give you an example. Oxygen. Whatever the case, if you have cluster headaches, if you have cluster headaches, you should get oxygen. Or like that actually should be like, no matter what, you should get oxygen, because that may actually just be enough. For a lot of people it isn't, but for a lot of people it is. um, but for a lot of people, oxygen doesn't really work. But then if you dig deep into it, the reason it doesn't work is that they're not using it properly. Let me give you a hint. You need a lot of oxygen. So there is this video in YouTube, and link in the description, where like, a member of Cluster Busters is educating a group of people on how to use oxygen, right? And he's showing like, well, the cannulas that they give you maybe in ER or something is like a little bit like air, through the nose. Like, no, that's not gonna do it. Even kind of like a specific valve that you use to breathe oxygen through your mouth, it has to have like the right shape and width to allow like enough volume fast enough, right? And the suggested protocol when you're starting to feel a cluster headache and you have oxygen nearby is to go and take the high flow oxygen and like really hard, and that is what has a decent chance of aborting a cluster headache. Okay. So for any of these things, make sure that you're actually investigating the right technique, and chances are, if it's not working, maybe the technique has to be tweaked. It might not be that actually the intervention doesn't work, is that you're just not doing it quite right. So that's an important piece of advice. And this is absolutely the case with DMT. As I will describe in a second, there is a art to it, and it works differently for different people. Again, maybe because of the multifactorial, contribution to the probability of a cluster headache. Yeah, different people have like different factors that are contributing to it. And so, yeah, you might need like slightly different techniques in a very personalized fashion. The next point I want to make is that 5-MeO DMT doesn't seem to work very well in this case. It works for some people. Like there are actually some reports of people trying 5-MeO DMT for cluster headaches and they get instant relief. However, there are also reports, more numerous, of people trying 5-MeO DMT on a cluster headache and it not working, which is a pretty bad idea. Especially, for example, if you confused it with DMT, because 5-MeO is like so much more potent, is easy to overdo. And it causes like this, time dilation effect. So that's like actually a hazard. Like if you take 5-MeO DMT while you're having a cluster headache, you're kind of increasing the subjective duration of that cluster headache, arguably the overall suffering. So yeah, don't do it. No, it's not recommended. Whereas, there are other things that are not as powerful as DMT, like ketamine. Ketamine doesn't seem to hurt though. So like, if you suffer from cluster headaches, give ketamine a shot. It may be enough, typically isn't, but it is reported as like something that, it kind of both lessens the pain and also extends the duration of remission. Okay, so protocols. Yes. Okay, so let's say that, yes, you have weaned off of some of the key medicines. You're not at risk of serotonin syndrome or anything of the sort. How do you approach these? Well, so here's the very encouraging piece of information, and that is that it seems that for most sufferers, you need very little. We're talking about like 3 milligrams. And I don't know how familiar you are with kind of the intensity scale for DMT, but let me give you a little bit of a sense of it. So the dose response curve for DMT is highly nonlinear. In that, like, if you take 1 milligram, you might as well not have taken anything. It's like, you really have to be like an advanced meditator or like really advanced psychonaut, like with a lot of, sensitivity and have slept well, etc., to like notice like, maybe there's a little bit of a change at 1 milligrams. Well, I bet deep in a meditation retreat, probably it's it's something you might be able to notice. But 2 milligrams, maybe things feel a little bit kind of like moist and liquidy, and you feel a little bit wet. It's hard to describe, but like that's approximately the direction of the effect. At 3 milligrams, you start seeing like colors a little bit brighter. Maybe a sense of things are not melting, but things are kind of like kind of liquefying a little bit. You may not even notice it. Interestingly, at that dosage, it is actually very clear-headed. It is not psychologically challenging. I mean, if you are like really anxious and you take 3 milligrams of DMT, you may make the anxiety a little bit worse. It also may make it better. For a lot of people, like small dose DMT is actually really calming and relaxing. Recently at a psychedelic retreat, I was hanging out with somebody who is for the first time, was trying DMT, and he was very afraid of it, and I said like, yeah, I'm very happy to sit for you if you wanna take DMT right next to me. I'll be here for you. You'll be safe. And he was being very cautious and taking very small amounts, and he was like, whoa, I did not expect it to feel so mellow. I didn't know it was so mellow. Well, he wasn't taking like 10 milligrams, but yeah, no, at kind of like that range, for a lot of people, is very relaxing. So it's not depersonalizing typically. Like, I would say it's like psychologically, like maybe comparable in how challenging it might be to like 2 milligrams of like an edible THC, where you can barely feel it. Yeah, well, by the time we get to 5 milligrams, well, that's where like the interesting qualia starts to emerge. That's where you start getting like some sense of like, okay, things are kind of like strobing. And yes, there's some kind of like liquid or some kind of viscous vibrating membrane that starts to deposit on top of your sensory fields. By the time you get to 10 milligrams, then we're in kind of like the territory of like, okay, this is as intense of 2 hits of LSD or something like that. Still, though, typically not as psychologically challenging. I think there's a very deep reason why, and it has to do with the frequency of the effects, by which I mean the frequency of the vibrations. It tends to be very, very high frequency. LSD is not as high frequency. And so interestingly, DMT affects your world simulation very deeply, but it affects first and foremost the high frequencies. So, your sense of self is actually a kind of like a mid-frequency type of representation. So it's not affected until you take a lot of DMT. So even, 10 milligrams of DMT is like kind of surprising. Like, wow, actually I can think clearly. I know who I am. I know what I did. But oh my gosh, everything is so trippy. When you get to like 15 milligrams, that is, when it starts to become like seriously psychedelic, and is where like DMT is like unmistakably its own thing, and like just no other drug. I mean, maybe other very similar drugs like DPT, for example, have similar characteristics, but yeah, none of the mainstream, let's say, psychedelics. It has its own unique flavor at that dosage, and nothing is going to replicate it. And if you actually want to have kind of the blast off, breakthrough experience where you completely dissociate from your body and you don't know where you are, interestingly, you still probably remember who you are. And the fact that you're on DMT, that's like 30 milligram range. And if you want to also forget who you are, or like maybe, become one with the universe, so to speak, but still full of checkerboard patterns and intense like tactile, visual, synesthetic sensations, like 50 milligrams. So, there's a wide range. And I would say like, if you're staying between 0 and 5 milligrams, it, for most people, really is not a very challenging experience at all. Again, people react to substances quite differently. So always, kind of like start with a very, very small amount and familiarize yourself with it. But, what I want to say is that, in the case of aborting cluster headaches, most of the reports emphasize that they only needed a little bit. They only needed, enough for kind of like, oh, the color's a little bit bright. And you feel safe, grounded. You're not traveling to other dimensions or being invaded by, UFOs or the Nordics, whatever it would be. No, that's not what's gonna happen. So I've got to reassure you of that. The other thing too is that if it doesn't work right away, you can keep taking it. So like, you take 3 milligrams, you hold it in for 30 seconds. Well, some people say hold it in, some people say, experiment with also not holding it in and see if that works a little bit better. There's like some discrepancies depending on who you ask, who uses this technique. But generally speaking, yes, like let's say like take 3 milligrams, wait 30 seconds, see if it's lessening the pain. If it's not really, then take another 3 milligrams, wait another 30 seconds, up to a minute, see how you're feeling, then take another. And you can keep doing it. I mean, for some people, it may take like 4 or 5. For some people, it just doesn't work, and that's important to mention. Unfortunately, no therapy works for everybody. In this case, I am estimating based on, anecdotes and a lot of people I've talked to. Yeah, I mean, DMT probably will work for like more than 80% of people is my current guess, when done optimally. But yeah, there's some people for whom it just doesn't seem to work, which is of course extremely tragic. But yeah, no, in general, the typical use case is where you only need, 1 or 2 like very low dose. And, we're talking about like 10 out of 10 pain going all the way to 1 out of 10 pain, 0 out of 10 pain. For some people, it may like be only up to like 3 out of 10 pain, but that's still like a massive, massive difference. I would argue, even if this only, took you from like 10 out of 10 pain to like 9 out of 10 pain, that still would be a huge, huge, ethical improvement. It would still be massive, massive from an ethics point of view. I will say, yeah, like experiment quite a bit. Highly recommended to experiment with DMT outside of the cluster headache episode. I mean, like DMT itself is prophylactic when it comes to preventing future cluster headaches. So actually, some of the people I've talked to who, for years, actually what they were doing was like taking high dose psilocybin every 3 weeks. Now they actually just get by having like one breakthrough DMT experience as a prophylactic once every 3 weeks. And with that, they just don't get cluster headaches anymore. That is kind of like in the huge success, huge success category. And interesting, these people actually learn eventually to actually enjoy the DMT experience and not be afraid of it. Which, tells you that, a lot of the discomfort you may experience on DMT is actually psychological and is resistance to the weirdness of the state. What I can tell you from by now, like over 1,000 DMT experiences at all dosages, I generally don't say like I'm experiencing things. I'm not an experienced piano player. I'm not an experienced painter, but I am an experienced DMT user. I really am. And what I can tell you is that, yeah, there's some gnarly, unpleasant DMT states, especially if you're in a bad mood to begin with, which I have experimented, again, in safe legal contexts. Thankfully, I'm very grateful. But on the whole, if you just focus on like, okay, like how actually unpleasant is this? Am I making it a bigger deal than it has to? It can be unpleasant, but it is like at the level of like a cold plunge, let's say, right? Like you can endure a cold plunge, right? Like it's unpleasant. Going into fairly cold water is like an unpleasant experience. But can you do it? Can you be there for 1 minute and survive it and not freak out and not be like screaming around and like try to resist and just gonna try to ease into it? You absolutely can with training, and determination and some mindfulness and maybe a little bit of exercise before and breath work and preparation. And yeah, you absolutely can do it. So I would say it's sort of similar, like DMT can be quite unpleasant, but physically it's not going to kill you. And if you just mindfully kind of like understand like, okay, these are like a bunch of really fast dissonant sensations, it's not that bad. And when I talk to people who suffer from cluster headaches, it's like, well, okay, relative to a cluster headache, how bad was like the worst you felt on just DMT? And they will say, yeah, it's a joke. It's just incomparable. Like there's just different planets, different universes. We're not talking about the same thing. Which is why, is one of the key reasons why I think like, oh my gosh, like, yeah, like there is a legitimate concern that, okay, like promoting psychedelics to reduce extreme pain will give people bad trips. Yes, absolutely. That's an important thing to prevent. But from an ethical standpoint, from a moral standpoint, I think the cost-benefit analysis is so skewed that like the chances of a bad trip have to be pretty high for it to not be worth it, in these cases. And usually, yes, I mean, the typical pattern is that if somebody's been suffering from cluster headache for years and they were saying like, well, I wanted to exhaust, like the medical interventions before I went into actually, trying psychedelics like in Mexico or Canada or something like that, typically they will say, I wish I had done that earlier. I wish I had done that 10 years earlier. I wouldn't have had to endure hundreds, thousands of PTSD producing events. Yeah, no, that is a typical response. So even, taking into account, the uncomfortable, unpleasant, high dose psilocybin experiences that these may have come with. There are, other concerns, of course, like DMT, especially high doses consumed frequently, can produce delusional disorder and also like sensory disturbances, HPPD. This is, I think, like really, really unlikely if you're just doing like 3 milligrams every now and then to abort a cluster headache. Like that's not, I don't think is really that much of a concern. But it is important to put out there that like, well, maybe if you become too comfortable with DMT and you start doing it a lot, right? Like you really have to, check in with others to see if your epistemology is, going haywire. By the way, maybe I should mention these, like, yeah, I'm friends with a bunch of people who care a lot about epistemology, including, like OG rationalists, let's say. A good friend of mine, Justin Chauvelin, for example. Yeah, we've been meeting a bunch about all sorts of things for many years, mostly having to do with AI, consciousness, intelligence, AI safety, things of that nature. And he, broadly speaking, has been, always telling me like, well, your sanity half-life might not be that long, just given the sort of experiments that you run on yourself. And so every couple of years, I just have a conversation with him where he tests my epistemology, where I like to kind of like make sure that, okay, am I actually doing appropriate Bayesian inference given the sensory input that I have and the, information that I've, consumed and integrated, and how good I am actually at evaluating the quality of evidence and information. And mostly because some of the conclusions I have arrived to are pretty weird, right? But I've got to reassure you, after having gone through, several pretty, pointed epistemic evaluations, I'm fine. I'm fine, guys. Like, my capacity to do Bayesian inference is just fine. It's just the information on which I'm applying that Bayesian inference is just, generally speaking, not available to most people. That's what I would argue. Of course, I can make mistakes. I can be confident in things that I'm wrong about, etc. But I mean, essentially, if your self-image is, let's say, like that of a philosopher, a scientist, curious explorer, as opposed to, let's say, if your self-image is that of a grandiose shaman, well, if you think you're you have a grandiose shaman personality and you take a lot of DMT, the DMT space will likely confirm, your suspicion that you're here as the next Maitreya and you're going to enlighten the world and all sorts of crazy things. You may start believing that, there's like UFOs in the back of the moon and they're colluding with the Russians. Even if it's true, though, the evidential base is probably pretty corrupted, right? Like, and the inference process is often compromised. But, what I want to emphasize is that, this is kind of like a niche problem, and it tends to also occur with kind of like personality issues. That like DMT itself as a compound is not typically the problem. The problem tends to be the memeplex and the pattern of use and the way it reinforces people's personalities. And whereas like direct organic damage from low dose DMT that will mess up your epistemology, I wouldn't worry too much about it. Okay, other things about the protocol is, what I have heard, not from everybody, but from a good number of people who use DMT to abort cluster headaches and migraines as well, although migraines is a little bit of a, different conversation, is that you want to hit the level that causes this like feeling of a body buzz, like which happens, starts to happen at around like 3 milligrams. At higher doses, it becomes really strong and overwhelming, like, and eventually your body explodes and you go to the astral realm and all of this stuff. But yeah, no, in small doses is typically neutral to pleasant, kind of like feeling of high frequency vibrations in your body. It can be a little bit unpleasant and jarring, but like typically is neutral to pleasant. That body buzz, unique to DMT, seems to be the thing that somehow melts the cluster headache away. So that as a target, right? So I wouldn't, recommend that, hey, if you're going to be experimented with this treatment, before you have a cluster headache and you actually need it in the moment, familiarize yourself with a vape pen. Even additionally have like 2 vape pens just in case one fails, and then really kind of learn to sensitize yourself to that feeling of the body buzz, the whole body buzz, and yeah, kind of like develop that sensitivity. Like how much do you actually need to take to get that onset, that sense of whole body relaxation? That is a target. I would also be extremely interested, if some of you suffer from clusters and try DMT, following the recommendations I've provided, and maybe you point out like, hey, maybe it's not the body buzz, maybe it is the colors, maybe it is like the sound, maybe something else, maybe the thing that determines whether the DMT will work or not, it might not be the body buzz. I'm suspicious. I suspect it is the body buzz. I suspect it's the body buzz, the core causal factor, and also it is the founder of the Eulocinia retreat, which is the retreat in Mexico that offers this treatment. Yeah, she also, based on hundreds and hundreds of experiences with people who have done this, they say, like, yeah, hit the body buzz, and that's what is going to do it. Okay, so lessening the fear. So here's, it starts to get a little bit more kind of experimental, let's say, the experimental part of the of this conversation. How do you lessen the fear to DMT and familiarize yourself with it, and have actually wonderful experiences with it? How can you boost the chances of that? Well, I already mentioned being in a good mood, right? But being in a good mood is just one aspect of it. I'm going to say bodily wellness. Bodily wellness is actually kind of, as far as I can tell, the best predictor of a really good DMT experience, because DMT experiences are highly embodied, really, really embodied. They vibrations in your body interlocking with vibrations in the visual field and audio feelings, and your body image getting twisted and contorted. Again, high dose phenomenology, but weird topologies of the energy body. And yes. Very, 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 very embodied, right? So you want that base to be consonant and harmonious. How do you do that? One recommendation is like, do aerobic exercise before an experience, like half an hour, 1 hour before, but just to kind of have those endorphins, like running in your body, like you've already kind of like have pumped the blood through your body, and so you're kind of like primed for letting the body, the blood flow in your body. That's a good state. Even better than that, a protocol that personally has worked really well to guarantee good experiences is as follows: I do 10 minutes of breath work, let's say like the Wim Hof guided meditation, guided breath work, then 10 minutes of loving kindness meditation, a guided, may all beings be free type of meditation, then 10 minutes of like a really relaxing kind of a spiritual song or ambient or even just like green noise. The point is like there to go really relaxed. And then again, another 10 minutes of breath work, Wim Hof or similar. That protocol, I mean, it's kind of based on principles of, neural annealing, neural field annealing, that like you're like energizing yourself, then you're tuning to a very harmonious and consonant configuration, loving kindness, and then you're cooling down and kind of settling that harmony, and then you energize it again. So you're energizing this harmony. And then as soon as you're done with the second Wim Hof, then, I mean, if you're feeling good, if you're feeling kind of joyous, if you feel like, okay, this is pleasant in my body, that's a good moment to take DMT. Um, because the DMT is going to build on top of those sensations and is going to amplify the harmonies, especially if you have as a, you know, pure intention is like, oh, may all beings be free from suffering, or hey, I want to understand the nature of consciousness to benefit other beings. That kind of clean intention with a healthy, harmonious body, like, whoa, very good, very, very, very good, wholesome, beneficial, healthy. Yes, I think maybe it won't work for everybody, but I've had pretty good success with that technique. Another kind of like adjacent, you know, and these are, you can stack these two, um, is something that I call like the pyramid method, which is okay, like, you know, you if you want to kind of like be able to explore the higher levels of DMT, and I'm going to make a video specifically about all of these methods as well at some point. I'm not in a hurry, but here's a bit of a teaser, which is that you can listen to a song that you really like, that is relaxing, that you can listen to in repeat, you know, that is kind of important, you know, that a song that you don't get bored of, but is also like nice and relaxing and pleasant. Um, because that being in the background reassures the organism that, like, you know, it knows where it is, right? It's like, oh, if you've been doing this in your bedroom, you know, at the same hour of the day, whenever you do it at the same hour of the day. Ideally, you know, you eat the same thing however many hours before, you know, you control the variables so that, like, when you actually have the experience, as many kind of contextual cues as possible are reassuring your subconscious that you are safe and in good hands. You know, contrast that with, for example, taking DMT in a loud public place you've never been in, you've never been to. Horrible, you know, don't recommend, right? Like, but the more layers of kind of like safety and comfort and reassurance and familiarity you add, the higher the probability it is that you will be able to actually focus on the experience and notice the things that are different and novel and interesting and remember them because everything else is standardized. So with that sort of method, you know, when I've been in retreats, for example, in Mexico, when I've had, again, the honor of being able to explore these, you know, I can do a small dose, then medium dose, then small dose. And that's kind of like a pyramid. So like every time, you know, I learn to kind of like bring back a little bit more from a slightly higher dose. And then like over time, you know, I may be able to do small dose, medium, high, very high dose, you know, high, medium, small dose. And in that way, I have kind of like what we call, you know, qualia tethers. There's a tether for an experience all along the way so that when I hit the next level, and DMT has many levels. I mean, I say there's 6, but actually those are also subdivided. So there's strata. There's strata in there. So like when you hit the next strata, you are familiar with the previous one, right? Like you can actually compare the current one relative to the unique characteristics of the previous one and encode it better. It's like, wow, okay, like now it went from like 3D cubes to 3D cubes that are kind of like spinning like this. Whoop, and now they unfolded. You know, if you remember that also, another detail is like, ideally you look at the same thing, every one of your experiences. Like for example, a ceiling or, you know, like a picture of a flower or something, but like something to standardize it so that also is another factor that doesn't change. And so you can really see the unfolding of the experience and internalize and understand the progression, right? So that in the future, even if you take a high dose, you know, you're not really that afraid, right? Because you know the levels. The problem of like kind of like just jumping to a high dose when you're not very familiar with the substance, especially, well, of course, if you're in a bad mood, it itself can be very unpleasant, but just the sheer novelty and overwhelmingness of going through all of these like strata, you know, one at a time, and not being able to recognize any single one of them, you know, that is like just the novelty blast is too much. Yeah, but you know, when you climb a mountain, you know, one step at a time and then come back, you're like climbing the Everest, right? Like acclimatizing. That is very, very reassuring to the organism. And you can go very deep and have like very little fear. I mean, fear seems to be largely a psychological reaction on DMT. That actually, if you don't have kind of that reaction, you can actually take fairly high doses of DMT and surprisingly be like pretty calm. which I find mind-blowing. Now, a panic attack on DMT is exceptionally unpleasant, and I think it's because it activates kind of like feedback loops, right? So, but if you're calm on a DMT state, you just the feedback loop just doesn't have anything to work with, and so like it's it's kind of like zero to the nth, right? Like it will continue to be zero. Okay, so downsides. Yes, bad trips. I talked about that. Psychological trauma, taking too much accidentally. Yeah, bad trips, psychological trauma. There's a lot of things that, yes, can happen with psychedelics, even when you take them in optimal circumstances. Again, what I can say is that from everybody I've talked to who have used this as therapy for cluster headaches, they just don't consider these like comparable, and so they say like, well, yeah, even if there is like some risk, I'm willing to take it because, yeah, from the moral calculus here is like, yes, I would rather have this than than another cluster. But yeah, interestingly, one of the things that I thought was kind of like fascinating is like even if you're for example in the middle of a psilocybin mushroom experience and you get a cluster headache, which sometimes happens, is rare, but like sometimes it happens, they still recommend like taking DMT during that psilocybin experience may actually abort the cluster headache, which I find like mind-blowing. Again, hinting at like maybe DMT's unique kind of like out there capabilities in this context. I will also like point out like the broad framework of suffering equals pain times resistance is especially helpful in managing psychedelic states of consciousness, because if you really internalize the fact that, yeah, if you lower your sense of psychological, physiological resistance to zero, pain doesn't really turn into suffering. You can go very deep in a psychedelic and not have like that much of a suffering reaction. Again, psychedelics are unpredictable. Some things. Sometimes you may depersonalize on psychedelics, even at a dose that you had taken before, and like nothing interesting had happened, right? So always have a cedar. All of these caveats cannot be stated enough. Now, onto I think like very promising avenues for future research. Again, because fear is reported as one of the key reasons why cluster headache patients, don't venture themselves into trying DMT as a treatment. I think, fear-reducing interventions are super high leverage. Now, one that I'm really curious about is, combination of DMT and other substances to reduce the fear component of DMT. From a recreational point of view, there are some like really excellent candidates. I can say that combining pregabalin with GHB, no, pregabalin with DMT. Don't combine pregabalin with GHB. No. Sorry. Pregabalin and DMT, three-letter drug. Pregabalin plus DMT. It's fascinating because you can go very deep into the DMT space with pretty much just no fear. Like just like the anxiety response is just completely subdued, or like almost nearly completely subdued. It also changes the quality of the visuals a little bit in a way that actually makes me suspect, even more so than liquid crystals are involved in the rendering of the world simulation, and a bunch of like nonlinear optics actually become more noticeable in that combination than with DMT alone. Just as an aside, but yeah, it's just fascinating that you can have these wild, breakthrough DMT experiences and have these crazy downloads from Buddha minds and hive minds and all of these weird stuff, and just not be afraid at all, even without having put in the work of, doing a lot of loving kindness meditation and, breath work and all these preparations, because, you took 300 milligrams of pregabalin before. Very practical consideration is like, I would recommend, yeah, like maybe taking it 1 hour before you intended to trip, or 90 minutes before, so like it's really hitting you. Also very important to have a cedar, always. But in combinations especially, because yeah, you don't know if like maybe it's too much for your organism and now you're gonna vomit, and if you took too much DMT, maybe you don't want to drown in your own vomit. That's less of a concern for DMT and it's more of a concern for 5-MeO DMT, but it's still a concern. So always have a cedar, especially if you take combinations. And then yeah, the other substance is like gabapentin, even phenibut actually. which is available as a nootropic. I mean, it's a benzo-like substance, maybe not as neurotoxic, but definitely just as, dependence causing. But, substances in the gabapentinoids, I think, class, are all essentially really good with DMT as far as, preventing the fear reaction goes. GHB has also, only GHB and DMT also. However, anecdotally, that does have like a significantly higher, probability of like vomiting. So I don't particularly recommend it. But I would be really curious if somebody who suffers from cluster headaches can abort, a cluster headache, or can take, like high dose DMT together with pregabalin, and still, benefit from the prophylactic and abortive effects of DMT. Because if that is the case, then hey guys, like maybe we just found the way. Like the protocol might be something like, yes, take pregabalin once every 3 weeks, and then take DMT an hour later, and maybe you just don't have any cluster headaches anymore, right? So I think this is really, 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 really high leverage if it turns out to work. And then the other one, which it didn't occur to me, I think this was Curran or Alfredo, but it's combining it with ketanserin. So ketanserin is a 5-HT2A antagonist, and it essentially blocks the psychedelic action of a lot of interesting agents without, in principle, blocking the action of other receptor types. And there is one compound, BOL 148, which is non-psychedelic, but does have this prophylactic effect against cluster headaches, which, of course, should be studied very thoroughly, and ideally, also we accelerate that as fast as possible. Giving you a proof of concept that you really actually don't need the psychedelia in order to prevent the pain. So, maybe a setup where you have a nasal spray of ketanserin, and you just like take enough to prevent the psychedelic action. Maybe you wait an hour or 45 minutes. I forget. Yes, it's not a very long half-life, so you don't need to wait all that long. And then you take DMT, and then see if, DMT plus ketanserin prevents cluster headaches, because if that is true, then yeah, we just don't need the psychedelia at all. I don't know how likely that is to be true. The thing that I am especially interested in finding out is if ketanserin also blocks the body buzz quality of DMT. Like maybe that is inherently a 5-HT2A receptor, mediated effect. It could also be that, BOL 148 just works by a different mechanism of action than DMT. That's another possibility. So there's a lot of life possibilities. But yeah, hopefully somebody trying ketanserin plus DMT will allow us to narrow down actually what is happening. With that, just like wrapping up, we're soon going to be releasing this initiative called Cluster Free in collaboration with the Organization for the Prevention of Intense Suffering, OPIS, as well as Cluster Busters, both of whom are, in the advisory board of the initiative. And it's an initiative incubated and developed at QRI, the Quality Research Institute. Very much, many thanks to Alfredo Parra for like taking the initiative to push this forward and really try to make a difference. And yes, one of the things that we're soliciting is video accounts, first-person video accounts of you guys. Yeah, if you suffer from cluster headaches or migraines and you try DMT especially, but any psychedelics, consider recording a 5-10 minute video describing your experience, what made it work, what challenges you encountered along the way, and just especially we can get kind of like your reaction about like how you thought this wasn't going to work but it actually did. Like that sort of thing is invaluable to us, from a PR perspective, from a utilitarian perspective. Yeah, we really want to make a big blast of this information and literally turn it into breakthrough therapy. in the near future. I think the case for it being, going through clinical trials is like super strong. As I mentioned, you only need to really show that it's like safe and effective. It is safe, pure DMT. It's extraordinarily safe. Like, I don't know if there's a single recorded death of just from pure DMT. It's a little bit like marijuana or LSD or mushrooms. It's just so hard to overdose on it from a physiological danger point of view. Of course, psychological trauma is a different matter. But yeah, physiologically it's definitely very safe. At the 3 milligram dosage, it's definitely going to be also psychologically safe and effective. That still remains to be seen scientifically, but I'm going to bet it is effective. It damn well is. So yeah, I think there's a really compelling case for actually like pushing through these, standard mainstream routes of drug acceptance. Especially we find like a way of making it slightly more commercially viable. For example, combining it with ketanserin. But then yeah, in addition to that, so yeah, of course, like if you have like experience running clinical trials, you're in the space, please reach out to us. We are gathering a cluster of people who are like committed and see the vision and want to push this forward. So yeah, please reach out. And then yeah, finally, yeah, I mean, like if you like what we are doing, if you like what I do more broadly, the investigations that I do, the videos I put out, the articles that I write, the projects that I lead at QRI, for example, the psychedelic retreats we held in Brazil and Canada, etc. Yeah, consider donating to QRI. Like right now, it's actually a really good time for a number of reasons. We're gonna have a fundraiser soon. But in the meantime, it actually would be very helpful for us to cover for some expenses to have some donations now would be a good time. So if you're in a position to donate to QRI, 5, 10K would go a long way, at least right now. So just putting it out there. And also, if especially you are, if you have there's anything in particular at QRI that you want to support, like for example, hey, maybe the thing that you think is the most important is like developing techniques for awakening, using 5-MeO DMT, or precisely something like validating our hypothesis that, the brain is a nonlinear optical computer. You can earmark your donation that way. You can say, hey, this donation is for your next DMT retreats or something like that. And yeah, I promise, we will use your donation for whatever you tell us to. Of course, I prefer if you give us a donation and you trust us that we will, allocate it properly. Hopefully all of the content and output and love that we've put out like showcases that, yes, we have a good idea of like how to use resources to produce like useful information that is broadly beneficial for the world. But yeah, no, and especially, yeah, if you are passionate about, cluster headache relief, you can earmark it. You can donate to QRI for cluster headache initiatives. Also, you can donate to the Organization for the Prevention of Intense Suffering and Cluster Busters. Yeah, I mean, if you have spare resources, this is I believe, with the biggest integrity of my heart, this is powerful intervention for the world. And with that, thank you so much, everybody. I hope it wasn't too burdensome to have this conversation about extreme suffering, but yeah, it's part of the package. I'll be seeing you soon, talking about other fascinating topics, and infinite bliss, everybody. May all beings be free from suffering, especially those who are trapped in hell. Take care, everybody. Ciao.